It's wonderful to see everybody here. I love the energy, and I know it's intellectual energy and physical energy, because you'll have a lot of stuff to kind of learn and glean along the way. I'm Terry Kramer. I'm the faculty director of the Easton Technology Management Center. I want to personally welcome all of you here. We have a lot of people that are joining us remotely as well, so welcome to them as well. This is one of our flagship conferences, Technology and Society. I cannot think of better timing than now to have this conference, especially with a focus on artificial intelligence and generative AI. Some of the most transformational, and we say it a lot in the tech sector, something is transformational. I think this is really, really, really transformational. When you look at the impact of generative AI, many people are saying it's the biggest sense of innovation, literally since cloud computing and before. So I think you'll get a big sense of all of that. A little bit of context here on generative AI and AI overall. McKinsey's done some really interesting work on it. Basically, they've identified $4 trillion potentially at a magnitude of benefit across multiple sectors. 60-70% of tasks that people are engaged with can get automated, and some very interesting outcomes from there. A variety of applications suggest that generative AI is not just about decision making. It's going to be about creation. You see this in media and entertainment. It's going to be communication and how we interact with one another, et cetera. So a lot of interesting things to happen there. We've got 3 panel discussions, keynote and panel discussions to go through a variety of applications here. So the first one you're going to hear from is Wara Ayagu, who is the Chief Medical Officer from Amazon, Amazon Clinic. I have a personal interest in really following what they do and how they do that. You'll hear quite a bit more from there. We've got 2 experts on product innovation, especially related to AI and generative AI, Alicia Zhao, and where's our other speaker? He's coming. Anoop is going to be here in just a second. So he heads up research AI for Google. So you're going to get some interesting perspective there. And then finally, we're going to have the co-founder of Siri here. So talking about conversational AI. His name is Adam Chire. So now let me give a little bit of context before we have Wara come up here. And one of the things you'll see with all of the sessions is we provide context to make sure we all have kind of a level set about the environments that these leaders are operating in. So let me start out on healthcare. What are some of the main messages and contextual areas with healthcare? 18.5% of GDP in the US is spent on healthcare. It is massive. It is growing roughly the cost 5.5% year over year. So significant increases. And when you look across the world, people will give good and bad ratings about US healthcare. Costly, accessibility challenges in many cases, performance, et cetera. And so a lot of opportunity to continue improving along the way. When you look at what a lot of the healthcare providers and payers have been doing to control costs, I want to rattle through a few of them again that says quite a bit about this first session. Blue Shield of California just announced that they're discontinuing their partnership with CVS Health on all of the pharmacy benefits management. In their place, they've announced Amazon Pharmacy, and they've announced Mark Cuban's own venture, Cost Plus Drugs, as well. The Affordable Health Care Act, one of the provisions that's been put in is putting a cap on in-network, out-of-pocket costs. So again, another example of cost pressure there. Technology investment in healthcare, huge amounts. So roughly $29 billion has been invested. $2 billion, so a big part of that is home health, remote healthcare. So a lot going on in connected devices, AI, et cetera. A lot of applications using AI in healthcare. So diagnostic capabilities is in there, drug discovery is in there, et cetera. Lots of the big tech companies are making big investments. So Google is in this, obviously Amazon is there, Moderna is in there, etc. Let me give you a few examples. So Google has partnered with the Mayo Clinic, and they are now working on their own enterprise search engine. So in essence, allowing healthcare providers to have easier access to data on patients, on clinical trials, on research, etc. Other applications that are being used at Google, AI radiotherapy treatment is being used, AI tuberculosis screening, AI retinal disease detection. So all of those things are just from Google. Moderna, for those of you that have been in my class, it's the kickoff case in technology management. I can't think of a better one about competing in an age of AI. So they view themselves as a digital-first company. They've developed an mRNA platform that allows data to be collected that they believe has helped them improve outcomes of vaccine development, speed to market, and lower costs. And their argument is they're going to be using this across vaccines of all types, for cancer, for cardiovascular disease, etc. Apple has already done a lot. Many of you know about their health app. Many of you know about the Apple Watch. They're fairly secretive, but they've a lot of reports saying that they're working on an AI-powered health coach. So for wellness recommendations, basically chatbot idea. And then finally, let me get to Amazon, because Amazon obviously is our focus today. As a reminder, every time you meet somebody with Amazon, I think they're one of the best companies for really making their culture clear and everywhere inside the organization. Value, convenience, and selection. Value, convenience, and selection. So one of the interesting topics we're going to get into is how does that show up in healthcare, because they've been very successful through a lot of areas. What have they done most over the past few years? They bought PillPack in 2018, so a prescription drug delivery service. They bought One Medical Group for about $4 billion. That happened just in July of 2022. So that allows them to use both brick and mortar and telehealth solutions in healthcare. Also what they've done, and this is the most recent thing that we're going to be covering, they've just announced Amazon Clinic. And they've announced it nationwide, so all 50 states now will have access. We're going to show you a clip in a second of what it looks like from a patient standpoint. Why is all this important? Amazon is basically now have the ability through brick and mortar solutions as well as telehealth to change how we experience healthcare today. When you look at telehealth before COVID, about 11% of people used telehealth. That number now is at about 45%. 45% of patients say they're using some form of telehealth through the year. So big increase, and they have the ability to do well there. So we're going to talk more about AI at Amazon and where does it take you in terms of, again, delivery of healthcare. The issues that we're going to go through with Wara here is how is Amazon innovating in healthcare? How is the patient experience going to be changing? What might be some of the changes that we would see? And most importantly, what Amazon is so good at, their supply chain management, their ability to manage a platform. How will that be used in this situation with healthcare? So I'm going to be introducing Wara in just a second here. As a reminder, we'll have a moderated fireside chat, and then we'll go to questions. We use exclusively Slido for questions. We like to walk the talk on technology. It democratizes Q&A. So you go to slido.com, slido.com. You can enter in your own question, or you can upvote one of the existing ones. And I will endeavor to pose the most popular questions that come up. So let me first have us take a look at the video clip, and then I will introduce Wara here.